Hi, everyone. My name's Shurajit Dutta, and myself and John Lewis will be presenting about the COVID-19 development that we've been working on with our colleagues at the university. So I'm just going to start my presentation here. So what we've been doing is actually making something called a standard configuration package. And just to give you an idea of what this means is that if you do have a DHIS2 system, we're basically trying to provide you with this starting point. Sorry here, just get rid of some of the extra stuff on my screen. We're trying to provide you with a starting point that allows you to kind of install something and then modify it and localize it to your own needs. So it's really about giving people a starting point, providing best practice configurations, and allowing those users then to modify this to really fit their localized needs. In order to do this, we've been using a lot of guidance from WHO, from CDC, from others who've really been telling us, what we actually need to do in order to make this work correctly within our system. So a lot of the variables that we collect, a lot of the processes that we implement, they're all based on these guidelines from these various organizations. And along with the kind of tools that we provide, there's also dashboards, indicators, analyses that are based on all this guidance that are provided in this. And we'll get into that a bit more as we go through this session. So what I wanted to talk about is the three types of packages that we have on offer, the different data models that we use. So there's some terms that we will be using a lot, in particular this tracker term. And for anyone who's not familiar, we just wanted to get everyone on the same page. So when we're talking about DHIS2 tracker, what we're talking about is a series of discrete processes that are linked together, to give you kind of one overall workflow that is linked to a specific individual. So if we're talking about COVID-19, then there might be various processes that will have a case go through that are all linked together and that we want to potentially analyze all this data and information together as one kind of shared health record per se for this one individual on this particular case. When we're talking about events, this is more of a single discrete process. This only occurs at a single point in time. There is individual data, but we're not really kind of searching again for this person. Once we enter them, that's it. We don't really go back and have multiple processes or workflows that are attached to that particular case when we're using the event data model. Lastly, we have the aggregate data model, and this is the counts of data. So it's not really dealing with individual data of any kind. We're not registering an individual, we're not following them through kind of multiple series of processes or interactions with our health system. We're just basically taking summary counts from maybe our health registers, etc., and then we're entering them in the system as actual counts rather than individual data values. Okay, so that being said, these are the various items that our package includes at the moment. So we have a number of tracker programs. We have one event program and one aggregate program. And what we're trying to do is basically offer a full kind of variation of what people would potentially need to do based on the requirements we have been reviewing and seeing in the field. And as well as from our partners from WHO, CDC, Gavi, etc., who've been advising us on some of the requirements that we need to think of and consider when we're developing these tools. So the first package that I'll talk about is this case-based surveillance tracker. What this does, it allows us to enroll and track suspected cases. It captures symptoms of those suspected cases, their demographic details, of course, because we are doing a longitudinal tracking of this case over a particular period of time, all the risk factors and exposures. We also have a lab requests and lab results information that is tied to this. Just to kind of iterate though, the lab portion of this program is very limited. It's not meant to replace any type of full lab information system. It's just meant to kind of enter very minor details, what test was requested, what was the sample that was taken, and what was the result of that test. So it's very basic in terms of what it provides, but we want enough information to allow us to classify the case. We can also link our confirmed cases with contacts in our contact registration program. We can also monitor the patient's outcomes, of course. So after a certain period of time, we can go back and update their health outcome if they recovered, they died, etc. Okay. We also have a contact registration and follow-up program. Okay. And this allows us to basically perform some basic contact tracing. So we can, if we have an index case that's registered in our case-based surveillance program, for example, we can register any type of contacts that were linked to this index case in this contact registration program. There is then a follow-up component of that program where maybe someone from a public health agency or a community health worker, if they're going and following up on the contact, checking if they do develop symptoms, and then performing the necessary steps in order to maybe refer them to a facility for further care and enroll them in this case-based surveillance program potentially if they do develop symptoms and are found to be kind of a case of concern. We also offer a port of entry screening program, and this is really heavily based on a design provided to us by the Ministry of Health and team in Sri Lanka. Actually, this is operational there, and it's in practice currently being used, where they're basically entering suspected cases that that register or that they find at the airport essentially, and then they're performing community follow-up on these cases. There's not a lot of air travel at the moment, as you know, so this has become more manageable actually, given that there's limited air travel. There's a low amount of cases being entered here, and they're able to kind of follow up on these over a 14-day period and clear them if they are in self-isolation, or refer them to a facility, of course, if they do develop symptoms. We also have an event program, and I talked about these data models at the beginning. So the event program is a simplified line list. And one thing that I will say, we've diverged a bit from the WHO line list, and this is more of a subset of that information. The WHO line list was quite long, and after some evaluation and internal consultation, we just decided to grab a couple of the key variables there in order to kind of, when we thought about it from an implementation point of view, make it a bit simpler. So, it'd be easier to fill out by actual facilities in the field. But that being said, we understand that if people want to use the full WHO line list, then that's also possible, but that's not something we offer at this point in time. We also have an aggregate package. This is just an aggregate data set, and all of these programs that I've talked about all come with dashboards, analyses, etc. And I'll talk about that as we go through. So yeah, this is just a visualization of the same thing. So I'm going to go ahead and just continue from here because we've already talked about these in quite a bit of detail. But just for a visual sake, move this here. Yeah, so these are the tracker programs and the event programs, basically, is how we've split it up: the clinical examination, lab testing outcome, port of entry screening, community follow-up, and contact tracing. Once again, these are all that tracker data model where you are registering an individual, where you are following up with them, where you may be performing multiple processes with them and interacting with them during multiple times within the health system. And then we have this line listing, which is, you're entering line by line, case by case, but you're not necessarily, there's no mechanism necessarily to find cases again and again and perform linked processes or series of follow-ups, etc. With those cases. And then the aggregate model is basically a summary of this clinical examination, lab testing, and outcome data that we've provided in this package. Okay, so as I mentioned, we use a lot of standard guidance and tools. We're releasing every Friday so far new versions of our package, only because the guidance has been changing quite frequently. As you can see here, one of the guidance documents that I've shown is from March 20th. As a result, we have to update our kind of tools to make sure they reflect this new guidance. This can obviously be challenging in practice to implement because of the number of quick updates that are required, but we are also working on guidelines and providing support to countries to make sure that they can update these items rather quickly so they can get up and running with the latest version of the tools as we update everything. So this is the first program that I wanted to talk about, this clinical examination and follow-up program. Sorry here. Yeah, I'll just go back. So this is the basic workflow that we've implemented inside of DHIS2 for this particular program. And this assumes that, the patient is basically attending a facility. So then they're screened, they're identified as a suspect, right? If they're not identified as a suspect COVID case, then, that's okay. Maybe they're receiving treatment for something else, or maybe they're just sent home. But if they are identified as a suspect, then, the workflow is kind of identified as if they're hospitalized or not. We have mechanisms for recording if they're hospitalized or not. And then, given they're given treatment, if they're hospitalized, there's some specific treatment that is provided to them. If they're not, then that is not required necessarily to be recorded. There's a case reporting form, a WHO case reporting form. It's one of the standard guidance documents I showed really quickly in a screenshot at the beginning. So this is probably also filled out in paper if they're not doing kind of this real-time data entry on the computer, which might happen in many cases where they might take the case reporting form and enter this shortly after maybe they've entered on the paper, if it's not kind of really available to enter as a real-time system using a computer or a Android device or whatever it might be. Okay, so once we have them kind of doing this initial diagnosis, etc., we then have the lab request. So this is for, after the sample is taken and then they identify the testing type, and then they need to notify the lab that they're sending this basically for processing. So there's a notification that is then sent to the lab, and the lab conducts the test, records the result. And once again, as I mentioned, this whole lab portion is very limited. It's maybe 3 or 4 variables in the lab request, another 2 or 3 in the lab results. It's not meant to be a really kind of robust, complete lab results, lab system, lab information system. It's just meant to record those results so we can classify the case. Once again, there are details for this filled out, maybe potentially on the paper form. And then we have follow-up conducted for a given period of time. This depends a lot on various SOPs, so we've basically allowed people to define what that follow-up period will look like. And then, if they do eventually get discharged based on what their assessment of their condition is after that follow-up, or unfortunately, if they do die, then all of these outcomes are then recorded, and we're able to produce data based on all of this information within this first program. The second program that we have is this port of entry. This is where they enter if any port, maybe through ship, through air, through kind of land, through car. And yeah, this is done to basically register the person if they are suspected, and then there is some follow-up in the community. As I mentioned, this is operational in Sri Lanka since the very early start of the outbreak. They found it very effective, especially now with the travel becoming much less. They found it much more manageable to actually do this and follow up with all their cases. We also have contact tracing, and you can see this is linked to both programs. Not only the clinical program, but also the port of entry program. So regardless of which program we're looking at, contact tracing can potentially need to be done on both of these programs, as well as any individuals that are identified as contacts as well. Now, there are a lot of contact tracing softwares, and I will say, to be clear, that DHIS, there's advanced analyses that is often required on contacts. Maybe this might be network analyses, for example, where maybe if you have a person who has contacts, and then you want to see the contacts of those contacts, and subsequently move farther and farther down that list, then there might be some other tools that might need to be supporting this type of analyses. What we're really trying to do is at least register these contacts, have a register of these contacts that are available, being able to show an index case as well as all the contacts that they have had, and also display the number of contacts, of course, for these index cases. And then we want to be able to serve this list up for other applications that might be a bit more robust in terms of performing this contact tracing analyses. So that's basically the provision we provided for this contact tracing. It's not necessarily an all-encompassing solution for the various contact tracing analyses that needs to occur in reality, often in a lot of cases, which is maybe more complex than what we're able to provide at this time. We also have this kind of events outbreak line list, which I discussed. This is basically meant as a, once they hit a threshold of some kind, then we have to kind of make sure we have some provisions to kind of switch over to an outbreak mode of some case where it's a bit easier to collect the data. This is the event program that I mentioned earlier. Okay. And then the aggregate data, once again, this is just the counts. We have analyses, etc. tied to this. So this is all the different data models that we're offering as part of these packages. We also have support Android. So we don't support iPhone at the moment, mostly because of scaling considerations, but all of our packages for COVID-19 are tested on the Android app before we release them, and we make sure that everything is compatible and working. So all the data models that I have talked about, case-based surveillance, the contact registration and follow-up, port of entry screening, the events, as well as the aggregate data. We can use an Android device to enter information on any of these items. It's all within one application, and we're able to also use a lot of offline functionality on Android, which is, can be potentially quite beneficial given this scenario where you might have people out in the field doing follow-up and assessing health outcomes potentially without an internet connection. So all of that can be saved to the phone and then synchronized back to the DHIS2 system once they have internet again, if that's not available when they're actually performing the assessment. Of course, if they do have internet, whether it be mobile or Wi-Fi of some kind, then everything can be done online and synchronized immediately. Yeah, so just a bit more on the Android. You can see some of the advantages of using this if you are considering these DHIS2 packages. We have kind of a lot of support efforts and testing for this at the moment. There's also some, we do mention that full offline support that I'm mentioning. There's also some provision to actually send some of these data inputs via SMS. So if you do not have a connection at all, internet connection of any kind, then some of these data items can be sent through SMS rather than through an internet connection, using the same app, of course, to do that. Nothing has to change with the configuration. It's more about making sure that the SMS mechanisms are working, however you happen to set that up in your country. We also have full translation support for all these various tools. So we've translated so far to French, Portuguese, Russian, and Spanish. This is a community effort, of course, where we're having members who are, more proficient in these languages support us on these translations. So you can see this is the data entry form here for one of the programs. It's been translated to French. You can see all the variable names as well as the inputs, etc., are all translated to French. All the outputs are also translated to French, so all our indicators, all our options for those indicators, all the titles, etc., have been translated. So we do offer full translation support for all these packages as well, and we're trying to basically share as much of these translations as we get them with the community to make sure that, if people want to do something in another language, in their native language perhaps, and this can be useful to others as well, we can offer that facility basically for as many people as possible to then actually use that translation without having to go through and translate everything by themselves. So right now we have quite a bit of country interest. We're at about 39, 40 countries that are at different stages of their request. This includes, some that are just interested or curious, but not really kind of committed to using this, as well as countries who've already set up testing and development systems and are asking for training in order to roll this out. As well as, of course, some countries that have already rolled this out, like Sri Lanka and Sierra Leone, for example, where this is already being used in practice to manage their COVID cases. So there is a lot of interest in this. We are trying to manage how we offer support. This does take some time to test and to make sure everyone is trained in order to utilize it. There's certainly no way around that, but we are offering a lot of online support at this point in time, given the nature of our current situation and a lot of the travel restrictions in place. We do, of course, have some people in these countries that are able to assist and support directly, but we are also developing a set of tools, general tools, global tools that can be used to train people to use this package as well, and those will be released shortly. So all the other packages we've made in coordination with WHO have a lot of training material with them, and we plan to basically release something similar. So if someone is actually using this tool and does not modify it too much, then hopefully they can use a lot of the training material we provided and not have to kind of spend a lot of time doing that given the situation and how quick this might have to scale up. Yeah. So I wanted to just talk about some of the resources that we have available at this point in time. We do have a live demo. We have an information page where everything is available, and we have a community page as well. So I'll just go over to the information page first. So this is where we are communicating all of our updates. on this. There's all kinds of information about the package, information that I've just presented to you as well, information on some countries that are already kind of using this in practice, as well as links to what they're doing. Of course, information on Android that I just discussed, as well as all the information that I've just presented. You can see there's quite a bit of downloads and quite a bit of documents and all kinds of different links. This can be a bit heavy to kind of look through, but I just wanted to kind of discuss what we are offering to countries in order to get them started. So we offer, of course, the package itself, this metadata file, it's called. This is actually the kind of installation file, let's say. So if I want to get started and set something up for my own country, for my own system, and I want to make customizations to that, I start with this kind of metadata file. I install this on my own system, and then I can make any changes that are required. Maybe I need to update indicators to meet local case definitions, or I need to add some translations, or I want to add a couple of variables, whatever it might be. That's all provided using this metadata file. And that's the whole idea behind these packages, is that we give you a very strong starting point that you can then customize to fit your own needs. Because of course, there will be some localization occurring for every country. We also offer installation guides and system design files. So I'm just going to open one of these up so you can see. What the system design file is basically it goes into a lot of detail in terms of what the program actually has inside of it and all the various workflows and processes that these particular items are kind of utilizing to collect their information and display their outputs. We have all kinds of screenshots from the program itself so people can understand what they're doing, anything that's kind of hidden or shown at various times based on logic. We identify here so people don't get confused when they open things and don't see the exact same thing that we've shown. We have information on how things are hidden, as well as all the indicators that we use to kind of calculate, as well as where we got these indicators from, of course, the guidance documentation. And this is true of all the different programs that we have. So this was the case-based surveillance program, and then we also have this contact registration. And then we have design documents for each of these items, basically. So if I go back here, just to that information page. So there's system design files for all our tracker programs, the event program, the aggregate program. We are releasing this port of entry program on Friday, so the design file will also be accompanying that. And we also offer detailed installation guides, but we are of course offering support. Not us ourselves at the university necessarily, where we are offering support, of course, but given the amount of countries, we do have a HISP network. I'll let John talk about that in a moment, where we are offering a lot of support to countries that we are already kind of working with directly, just because of, they have a lot of familiarity with these countries, a lot of expertise and experience working with these countries. But the idea is to basically at least provide some guidance in terms of how we would install these. It can be a bit tricky if we're installing these on existing systems, but we made it as simple as possible to install on a new system. Yeah, there are some caveats here, and we've tried to identify all these in the installation guides. Yeah, so we also have all the training material that will be coming out. That is not available yet at this time, but that is we've been working a lot on kind of getting the package, all the variables, all the indicators, all the outputs. We've tried to make sure as much as possible that we can really make sure to utilize the guidance we've been given. But we'll release something new this Friday with a bunch of updates, which we will have information and documentation on. And but then we will also start focusing a lot more on kind of all the extra material that is kind of goes hand in hand with this, the tracker material and training material that goes along with this. We've also have a number of other kind of links to kind of pieces of extra help. We have this discussion and support channel on this platform. We have the community of practice. It's been a bit active lately on asking various questions for questions on the package. We try to update this as much as possible as well and try to monitor this as closely as we can so we can answer various questions. We have an FAQ as well where we're kind of trying to answer, basically common questions that we are seeking. The idea is to share our responses with the overall community rather than just, have one-on-one conversations that might not, only benefit one person, because we are seeing similar issues pop up as we deal with, all these countries that are having requests for support at the moment. So we do want to make this kind of a global document basically available to anybody to request support, and also, to make sure that our answers to their questions are shared with everyone who are facing similar problems. So I'm going to hand it over to John and just let him add a bit more about the HISP overall support, and as well as the package itself, and kind of what we've been discussing with some of our partners and implementers as we've been working on this. Okay, so I'll hand it over to John now.
Hi, thanks, Nick. I don't have any presentation or anything, but I just wanted to talk about what we are trying to do with HISP Vietnam and the support from the University of Oslo, and with the talk with other organizations, is to how best we can try to support the countries, basically on the countries where they don't have DHIS2 and they want to start using DHIS2 for the COVID as a initial stage. The server support, and as well as the hosting, the patient security issues, and other things. So one of the things what we've been trying to deal with, we already have a package where DHIS2 can be installed in any of the secure hosting server, whether it can be in Wipro or it can be Zero data center, so that like the other countries where we don't really have so much technical support, they can try to get benefit of using that one. What they have to try to deal to give is just the organic list where their country name, their province name, and their facilities, and we can set those things up in the same instance or different instance, and people can start using it without worrying about how do I set all these things up, whether it is secure or not. So that's also one of the things which we've been trying to focus on. We also been working on with the different integration platform. Sometimes most of the data are collected at a different platform. For example, the screening and everything is done in the airport. They already have their software, even in Sri Lanka, which has been pushed to DHIS2 using a simple API, and also the linkage between the OpenMRS and other things. We also been working on like allocation, especially for the Health Administrative Authority, when they can allocate, okay, which hospital has the capacity to have more clients. That's where like we have been trying to find out a bit more challenging. Is saying, shall we send to this particular hospital or not? Because the people, we don't really know the caseload at the different places. So that's also something which we can try to work on with the things. That's still under development, but that's something which we can try to deal with. And apart from that one, we've been working with Vanuatu and the other different countries in the region and Laos to set up their own system, so that like we can try to learn from them better, and we can communicate to global, so we can learn from them and we can like include that in the generic packages. So that's all from me. Thanks. So we can open for, I know there are lots of questions on, so a few of the questions I try to answer it, especially for Chandri and Mark Landry. There are a few other things which I've been like trying to still see it, so we can take it over the call. The first thing about the Khmer language is Chandra, like as you know, like it's every data element need to be translated. The translation support is there, but we don't know what it is called. So, for example, refer to can be meaning very differently in different places. So if we can give us we can give you the list of all the things, but we need to know what that means. Once it is done, so we can try to include that one in the package. That will be one of the best thing to try to deal with it. All the metadata packages are there, But like as and when we go around, we can try to include all the translation as we need. And this translation, you can do it. It's not us. So there is no developer need to be included. So we can also give you the list of all the metadata, and you can try to include all the translation to that one. That's can be the one of the things which should be fine. Mark, Carl did an analysis about comparing with Somaris and all other things, or mainly on the integration type, including Fire, OpenMRS, LS, ERCS, and other software which are collecting COVID, and how best it can try to interact. I also had a talk with the Tupaya people today morning in Tonga and Beyond Essential, how best we can try to share the data across. DHIS2 in most of the places act as a data warehouse, and they probably been using Tupaya, or the users have been using Tupaya, and data can be synchronized across. That's not a problem. So we can try to work on that one also. So let me just see.
Yes, hello. Can you hear me, Sir John?
Yeah.
Yes, okay. So thank you for answering the first two questions. We have another question from Sir Kenneth. So he's asking, majority of my colleagues are using iOS or Apple. Do you have an estimate when will this be available in App Store?
Actually, like, we don't really have a plan on making an app for iOS. Even though like we support, like when you open in your Apple phone the same URL, it will ask for mobile version or desktop version. But that's based on your browser, whether it is Chrome or Safari, that's fine. But we don't really have a specific app like we have it in Android. Since all our development has been focused on the Android, we don't really have any support on iOS yet.
Thank you, Sir John. We also have other questions from Sir Mark. So the first one is, looks like it must have 2.3x or later version running. Is that correct?
Yes, this is one of the things we've been like trying to find a challenging about, because we made a decision on making the COVID module on 2.33, which is the latest release of the DHIS2, to include all the features what we didn't had in the before version. So we know most of the countries are using the older version, and since it is a very urgent need, so one of the recommendation what I've been also giving to Lao, to other places, is to set up a simple DHIS2 hosting where we only focus on DHIS2 COVID platform. And once the systems are been upgraded, we can include the same data into the production server or in your routine server. But porting it back, this functionality to the older version will be very hard, and it will take a much more longer time. Since the time was an essential, so we've been only focusing on the newer version, and this is what we've been trying to work on.
Great. Thank you, Sir John. We have another question from Sir Mark. So it reads, what about mapping going from phase 1 to phase 2, clustering, and phase 3 community transmission hotspots?
I guess like this question, like I'll address to Nick. He's more epidemiologist, so he will has more of an answer.
Yeah, sure. Yeah, so we do support mapping functionality, but you know, right now it's quite tricky in terms of gathering those coordinates. We are able to, yeah, so we can get these community hotspots, but once again, this is really in practice a bit challenging. As long as we can get those coordinates in for the various parts of the program that we're trying to achieve this mapping, then we are able to perform that mapping, and we can cluster these cases. But getting those coordinates is kind of the challenging part. What we've tried to do in some places, John can comment more, of course, is to have predefined lists of maybe villages or whatever it might be. In very large countries, with populations over maybe 50 million, this becomes quite challenging. But in some of the lower population countries, we might be able to handle it a bit better. So I will say it's possible, but challenging in practice to get these coordinates and to perform that mapping.
Just to elaborate on that one, in Lao, like we have mapped all the villages to its respective ordinates, to respective coordinates. So when a patient coming from, they select their district and their village, the coordinates are already been automatically mapped. So we can try to get the things done. So if we already have a predefined mapping of a few hotspots and other things, it's very easy. Or other way is the people who are entering the data, they can select the coordinate on the data entry screen. But what we have seen in last couple of years, the data entry people are usually don't do that one. They don't want to click on the map and the things, so they just like leave it blank. Apart from that one, so if the data entry process and you already have a predefined things, then the clustering in the map works very fine. Beyond the GIS developer has worked very good on making this clustering and also relationship between the index cases and as well as the testing case or the contact trace.
Yes, thank you, Sir Nick and Sir John. So our next question is from Dr. Magid. The question is, we're using the COVID-19 tracker in some West African countries, but unfortunately the resources are in English, so each country is working on translating all programs and data elements. Is there a way to have this multilingual support or module to integrate or a joint translation document that we can all use?
Yeah, maybe I can answer that one. So just addressing specifically for French, there is a team based in Togo, actually. We will be releasing the new version of the package tomorrow with the French translations embedded. So if you are starting off with that and you are just basically installing this on top of what you have, you can basically have those French translations for everything that they've translated for you. Rather than doing documents and asking countries to do this on their own, we're trying as much as possible to centralize this translation effort so we can share them with everybody. So look, have a look tomorrow, or you can contact us, of course, and we will be releasing those translations. For other countries, I know there's asked questions about Khmer, etc. John's made one point about that, but anyone who's happy to be involved in that translation effort, who's thinking about using this and might want to perform this broader translation, please let us know. One thing is, of course, we don't want you performing translations that have already been done because we can offer them to you. And then another is if you are really interested in using this and want to translate, then please synchronize with us and we can let you know how to get more involved in that effort. But yeah, we will be releasing the French ones tomorrow at least.
Right. Thank you, Sir Nick. Our next question is from Sir Siddharth. It reads, do you have use cases where your solution might work with other disease outbreak or surveillance systems?
So John, do you want to take that or should I?
Yeah, you can, because like you are the one who've been trying to integrate the surveillance.
Okay, yeah, so what we've done is, so WHO, along with their case reporting forms, has given codes to all the data elements or variables or however you happen to refer to these items in their tools. We've also been looking at, I saw there was a question earlier on integration, etc. So Digital Square, this kind of body has been looking to coordinate, giving us codes, access to codes from all different systems, etc. But what we've decided is this is quite a big process and those codes are not as well defined. So what we've done for now is taken the WHO codes that have been provided to us. In cases where there aren't WHO codes, we've just tried to follow the same pattern. So if there is some type of data exchange that needs to occur, we have MSF, for example, working with us. They have an Excel sheet line list that is basically they want to bring this data into our tracker package. And what we've done is basically use these WHO codes to map their line list to our system in order to allow them to bring this in. If there's other pieces of software, etc., I think the integration mechanism might not be 100% clear to us at this point in time, but what we are trying to do is at least provide as many codes as possible. So we have the WHO codes for now. This doesn't mean we're not going to integrate codes from other tools, maybe potentially such as SORMAS or other tools that they're working on, maybe ADX codes that we can use to transfer data. So we are trying to provide as much codes as part of our package in order to allow people to use the code that they're most kind of comfortable with. We're still waiting on some of these overall coding efforts to kind of materialize. So for now, we've used as much as of the WHO codes as we can to allow for that mechanism to occur.
Thank you, Sir Nick. Our next question is from Sir Brent. Can you talk about data security and how data can be exposed to authorized providers, say in a province or territory, versus what data is exposed more pseudonymously, no patient identifiers?
DHIS2 already has lots of data security issues, and it's built around the tracker data issues, because we were collecting HIV/AIDS metadata. So we have multiple data security at various different levels. First thing is only the health provider can see their own patient level data. The second one is even the people who have been have like admin access or database access for technical people. If they go to database, they cannot see anything because it's all encrypted at the database level also. Then at the higher level, the people can only see the case-based data, not any kind of individual names or anything, even though they have they are at the Ministry of Health or the national or the province level. Based on their roles and the things, they cannot really see the names or the contact details of any particular person. Said that one, all these things works if you set it up properly. So all these settings are already available and no programmer is needed, but like you need to set which are the different fields should be patient anonymized and which other fields should not be the patient anonymized. And we also have access, like for example, if a lab person is getting a request, so they cannot see the name of a person or anything. What they can only see is the lab number and the sample details. They cannot see who they were, where they were, or anything, and they can only edit that particular details. Again, the other security what we also have is something called breaking of the glass. If two health facilities, they are sharing both are in the same program. For example, both in the COVID program, they want to check around if the patient has already been there. So one patient can request the access for the other their data, which has already been registered in other health center, and they give a formal request, and then the person can the registered health facility, they can give the access. There also a rule like where sometimes you don't need to set those things, and the particular person can be able to see data, what's happening in other places. But if he sees more than unlimited number of amount or some kind of different things, so there will be a message sent to the people saying that this particular user is misusing his authority, and then it will be logged down. There are quite a lot of patient security aspect has been introduced in DHIS2, but you need to the admin user need to set up all these things. We also have some couple of SOPs and all how best you can try to deal with it, and all. So I don't worry so much about the patient identity and security, as it has been already been covered and tested and investigated in DHIS2 when you try to use it.
Thank you, Sir John. To all our participants, if you still have questions, you may type them in the questions box. Our next question is from Dr. Sok. Can I ask about the COVID-19 module dependency? Is it required to host it in the cloud with the HISP team, or can we host through a standalone server?
No, like actually, as you just see, like DHIS2 is a free and open source system. So you can download DHIS2, install it, and also you can download the COVID module and install it. There is no need of like hosting it, anything. And most of the HISP team don't even have a hosting thing. It's already hosted by some other third party or by the government. So we don't really host any of the database. We just support the Ministry of Health in hosting and giving them the guidelines. If you already have enough capacity to host some things, please go ahead, and you can like always post any questions or things you have. So there, it is nothing to do with that like it has to be on HIS Vietnam or other things, but you can always ask us the questions. So if you need any kind of support, or like if you are stuck with some problem, you can always write to in the DHIS2 community or the COVID channel, which Nick presented in the during this presentation. So we are always happy to help around. It's not only us, but like most of the people around the world.
There's a follow-up question from Dr. Sok. If they host it on a standalone server, how can they get the updates and the functionality?
DHIS2 has been there are two things. One is on the server side, or the bar file side of the software. So we release the version now it's 2 times a year. Every time we release the version, so you can like just use it. If you're using the newer version, the upgrade is automatic. And if there is any metadata changes, that's something which we need to try to deal with it. But the software update, you can just like update it directly. So that's not a problem. But like please test it before you do it in the production server. Before you upgrade, try to test it in your development server and the training server. And then once everything is okay, then you can try to upgrade it to the newer version. So all these releases and everything are there. So you can use it, upgrade it automatically.
Thank you, Sir John. Our next question is from Dr. Jolo. How could this app contribute in the preparedness and response of national government cut across different levels?
Yeah, it's a more tough question, because like as there was also just saw some of this question before, like there are multiple actors involved on COVID. How best we can try to link around. That's nothing to do with the technology, but like it's more to deal with the coordination and the practice. How best we can try to deal with it. And different countries has different rules and different mechanism of interaction. If they already are using other system, it's not good to replace anything with a DHIS2 or with any other system. Just let them continue, and the focus should be on integrating the data, because we want to collect the data as much as possible in any format or any system, and then we should work on integrating the data so that like we complement each other's system together. So maybe the port of entry, maybe from the airport, they have their own system. Like in Sri Lanka, they had their own system, but then all the suspect cases were transferred automatically to DHIS2. So those are some things which you can try to work from. DHIS2 offers the integration mechanism where data from any other system can be pushed into, unless we give them the username and password and authority. The data can be pushed across without doing the manual data entry. Those are something which we need to try to work around. Apart from that one, technical thing is much easier to try to deal with. Most of the people who've been made the software, they know how to do the integration, but more challenging question is on the organization and the routine practices to share data across different departments.
Thank you, Sir John. I think that's the last question. So thank you for the work that you do, and especially for making time to share this with the AeHIN community. So before we end, any last words from our speakers?
That's all for me. Thanks a lot.
Yeah, thanks everyone. And yeah, if there are any questions, please reach out. Maybe we can find a way to get the presentation to you with all the links. If you do have any questions, please feel free to let us know.
Thank you, everyone. Bye.